From the lungs, the blood needs to return back to the heart, and the heart needs to pump it to the whole body. Why? Because the heart is the organ responsible to give blood to the whole body. So it's not that after the blood went to the lung, it became oxygenated, it can be pumped directly. No, it needs to return back to the heart again. So again, cardiovascular system, it's the system that is responsible to pump blood to the whole body. As we said, the blood from the heart, it will go to the lungs, it will become oxygenated. From the lungs, it will return back to the heart again, and the heart will pump it to the whole body. Okay? So for the cardiovascular system, like you can see in this first picture, you have some blood vessels. Like you can see, some blood vessels are red and some are blue. So for the red blood cells, those are called arteries, and they carry oxygenated blood. For the veins, they are blue, and they carry deoxygenated blood. Blood that doesn't have oxygen. That's why when you do blood tests, they take from vein, they don't take from artery. It's deoxygenated blood. So again, the cardiovascular system is the system that pumps blood to the whole body, and it's made of blood vessels. It has a lot of blood vessels. Some blood vessels are red, those are arteries, and they are carrying blood with oxygen. And some other blood vessels, the one that you can see, it's blue. Those are veins, and they carry deoxygenated blood, no oxygen. Okay? Okay. So the food for the cardiovascular system, it will be the oxygen, and the waste will be the carbon dioxide. Okay? Any questions for this page? Just simply, what's cardiovascular system, what's the artery, and what's the vein, and what's the food, what's the waste. That's it. Nothing to know else. In the next page, page 83, you have what is blood. Blood is a type of tissue that is fluid. So like you can see in this test tube, you have 55% it's the plasma, and 45% it's blood cells. Yes, plasma, like you can see, it's more yellow in color, it's not red, and it's 55%. This is what you put in your hair and in your skin. Okay? For the other, it's the blood cells, like the red blood cells, white blood cells, platelets. Okay? So this is the blood structure. It's 55% plasma, 45% blood cells. So like you can see here, it's written 4 to 5 liters. We have blood. For babies, they have 300 milliliters of blood. So again, for adult body, we have 4 to 5 liters. For newborn or babies, they have 300 milliliter of blood. For the blood pH, it's alkaline. Alkaline means it's same as the soap. You know what you wash your hands with? It's alkaline. It's the same as the bleach. What is bleach? When you have any stain on your clothes, to wash it, you will add bleach. This is also alkaline. For the blood also, it's alkaline. The skin, it's acidic. The lemon, it's acidic. The urine, exactly. The urine, it's acidic. So it's here.
Ouch.
What is blood and the pH?
pH.
Page 83. So if you go more down, you will find what does the blood do. What does the blood do? What is the function of the blood? First of all, like we said, it's transporting oxygen, the food, the nutrients to your whole body. What else? It's transporting carbon dioxide. So it's taking away carbon dioxide from your body. What else? It helps fight infection. How your blood is fighting infection. So remember, yes, remember when we said here we have 45% blood cells. One of the blood cells that you have, it's the white blood cells. It's called leukocytes. White blood cells, they fight infection. That's why remember in the beginning of the in COVID, before they start doing this nose test, they were doing blood tests. And when they will find the white blood cells is high, it means there is infection in the body. Okay? Even if you sprain your ankle, you twist your ankle, if you do blood test, you'll find the white blood cells count is high. There is inflammation or infection in the body. The body is increasing the white blood cells so that it can fight this infection. Okay? So one of the functions of the blood is to fight infection. What else? It prevents the loss of fluid by blood clotting. What does it mean? So remember we said 45% is blood cells, right? So one of them is the white blood cells that fight infection. We have another blood cell, it's called thrombocytes or platelets. What is this blood cell? When you get cut, this type of cells, they need to work so that this cut will close and you will not lose a lot of blood, a lot of fluid from your body. So this is also one of the functions of the blood. It has some cells, when you get a cut or even a bruise, this type of cells, they start working so that they will close this cut and you will not keep losing a lot of blood. Okay? The last function for the blood is to regulate the body temperature. So the circulation, the blood circulation, this is what keeps you warm. That's why in winter you feel more cold in your terminals because the circulation there it's less. So here you will not feel cold. Sometimes even you will wear crop top in winter, it's okay, right? Because the circulation here, it's a main circulation, big arteries, they are here. So the circulation is good. Your body temperature is regulated. But for the terminals, you will feel more cold because the circulation is not that strong. Okay? So again, we have a lot of functions for the blood. The first one is to transport oxygen. The second one is to transport carbon dioxide. The third one is to fight infection. 4 is to help for the blood clotting so that you will not lose a lot of fluid. And the last one is to regulate the body temperature. Okay? Any questions for the functions of the blood? Okay. Next, as we said, we have the plasma. It's 55% of the blood volume. And for the plasma, it's a straw-colored fluid. Like we said, it's not red, it's a bit more yellowish, like the urine. Okay? And also like the lymph. It's not red. So for the plasma, it has a lot of proteins inside it. And the plasma has a lot of functions. It's responsible to transport a lot of things in your blood. It's transporting salts in your blood. It's transporting nutrients. It's transporting waste, hormones, enzymes, gases, and antibodies. You don't need to know the details, just know that the plasma transports a lot of things in your blood. So plasma is responsible to carry these things and transport it, okay? So what is enzyme? Enzyme is a chemical substance, usually it's made of protein. Enzymes, usually they are responsible to break down something. Like how? Like for example, you have some enzymes in your stomach to break down protein when you eat chicken. They are responsible to break it down. Also in your blood, you have some enzymes. So the plasma, it's transporting enzymes. What is antibodies? Antibodies is the body's protection. What does it mean? Remember when you took COVID vaccine? It means now you have in your body antibodies against COVID. What does it mean? If you get COVID, you have something inside your body that will detect, I know this virus, it's COVID, and I can fight it. Okay? So for the plasma, it's transporting antibodies. It's taking the antibodies from one place to the other.
Like all vaccines.
Like the vaccines, exactly, all vaccines. Sometimes also in your body you have some type of antibodies that are made in your body just originally without any vaccine. Okay? So in this page, we need to know what is blood. Like we said, it's a tissue that is fluid, and we said that in adult body it's 4 to 5 liters. In newborns or babies, it's 300 milliliter. And we said that the blood is alkaline, the pH is 7.4. Then we said 5 functions for the blood. After that, we said what is plasma. Plasma makes 55% from your blood, and it has a lot of proteins inside it, and mainly plasma, it's used to transport a lot of things in your blood. Okay, it's carrying a lot of things in your blood. That's it. Let's go to the next page, page 84. The blood cells. We said the blood cells, they make how many percent? 45% of the blood volume, right? So let's start with the first type of blood cells that we have. We have mainly 3 types of blood cells. The first one is called erythrocytes, or red blood cells. Like you can see in this picture. This is how it looks under the microscope. Okay? So it's like a plate. It's a concave type of cell. It's like this, concave. And it doesn't have nucleus. Remember when we said what is the basic structure of our cell? Nucleus and cell membrane, right? So for our red blood cells, they don't have the nucleus. Okay? So what is the function of the red blood cells? They transport the oxygen. So they attach to the hemoglobin. What is the hemoglobin? This is the thing that is needed for the iron to be absorbed in your body. Okay? And also the vitamin B12. So these two, to be absorbed in your body, they need red blood cells. Okay? So the red blood cells, they attach to the hemoglobin. What is hemoglobin? It's needed for the absorption of iron and vitamin B12 in your body. Okay? If you go down, you'll find general characteristics. Some general characteristics for the red blood cells. So we have 5 million red blood cells for every milliliter of blood. So 1 ml of blood has 5 million red blood cells. Okay? You go down, you will find where it's produced. It's produced in the bone marrow. So as we said before, that our blood cells, they are not produced in the arteries or in the veins or in the heart. It's produced in the bone. That's why people that have blood cancer, they do the surgery for bone marrow transplant, so that the cells that will be produced will be clean, not with cancer. Okay? Next, you have the lifespan. How much time this red blood cell is active till it will be broken down and new red blood cells will come. 120 days. So every 120 days, our red blood cells are renewed. New cells will come. What are the organs that break down the red blood cells? It's the spleen and the liver. It doesn't mean that they are bad organs, but because they have lifespan. So it needs to be broken down. Okay? The last thing we need to know about the red blood cell is that the oxyhemoglobin is what gives the red color for the red blood cell. Oxyhemoglobin, oxygen and hemoglobin, iron and vitamin B. Okay? The second type of blood cells are called leukocytes. Leukocytes are the white blood cells. Like you can see in the second picture, in the middle one, it's a large type of cell, and in the middle it has nucleus. Red blood cell, it doesn't have nucleus. Again, some general characteristics. Of course, as we said, the white blood cell, the function to fight infection. Some other general characteristic is that we have 8,000 white blood cell every milliliter of blood. Of course, like we said, the numbers, they increase if there is infection in the body. Same place, it's produced in the bone marrow, but the lifespan, it depends from hours to years. It depends how frequently you are getting infection, you're getting virus, flu, whatever. For me now, it's broken down because I was sick, okay? The third and the last type of blood cells are the thrombocytes. What are the thrombocytes? Platelets for the blood clotting or blood coagulation. When you get cut, it needs to close. So those are the cells that work for this. So like you can see in the third picture down, they are just small type of cells and they don't have the nucleus. They have another organelle, it's called mitochondria. So they don't have nucleus, they have another organ, it's called mitochondria. This mitochondria, it's an organ inside the cell to produce energy, okay? So some other general characteristics, we have 250,000 of thrombocytes every milliliter of blood. Again, it's produced in the bone marrow and the lifespan is only 10 days. So red blood cells, the lifespan is 120 days. The white blood cells, it's hours to years. The thrombocyte is 10 days. So if I ask you a question and I tell you, which blood cell is responsible for blood coagulation? Red blood cells, white blood cells, thrombocytes. Thrombocytes, the last one. Blood coagulation, to close the cut, okay? Which blood cell is responsible to fight infection? White blood cells, it's called leukocytes. Okay. True or false? When you have infection, white blood cells count increases.
Yes, true.
If you have infection, white blood cells count increases. You will have too much white blood cells. Okay? White blood cells, leukocytes. Which organ is responsible to break down the red blood cells? Which organ?
Spinal cord.
Here.
Liver.
Yes, spleen and liver. These two organs, they break down the red blood cells. Spleen and liver. Here on the left side. What gives the red blood cell the red color? Is it the bile? Is it oxygen? Is it oxyhemoglobin? Oxyhemoglobin, the oxygen with the hemoglobin. So it's not the bile, like the urine, and it's not oxygen, it's oxyhemoglobin. Okay. Let's go for page 85. Do you have any questions so far?
And every 7 years renew all our cell body.
Every
7 years.
all the cells of the body,
Renew.
every cell has its own lifespan. It's not the blood circulation is happening. So for the heart, we have 4 chambers or 4 rooms in the heart. So we have upper 2 chambers and we have lower chambers. Like we said that the heart needs to pump the blood to where? To the lungs, right?
Yeah.
In the lungs, the blood will be oxygenated. After that, it needs to return back to the heart again. And the heart will pump it to the whole body. So let's speak in details about how this is happening. First of all, the heart will collect all the deoxygenated blood from your body. So deoxygenated blood, it will be collected by two main veins in your body. The first one is called superior vena cava. Superior, it means up. Superior vena cava, it will collect all the oxygenated blood from your upper body. So from your head, from your neck, from your arms and chest, upper body. The other vein is called inferior vena cava. It will collect the deoxygenated blood from the lower body. So abdomen, thighs and legs. Okay? Now all the deoxygenated blood will go to the heart. So the first room that you have it in your heart, the first chamber or room, it's called right atrium. From the right atrium, the blood will go to the next room, which is called right ventricle. So the upper two chambers are called atrium, and the lower two chambers are called ventricles. We have right and left. Okay? So the blood from the right atrium went to the right ventricle. Here, like you can see, you have something like a door or a gate to open and close. Why we have this door? Because when the blood will pass to the right ventricle, I want it only to go to the direction of the lungs. I don't want the blood to return back again. So here I have something like a door. When the blood will pass to the right ventricle, it will close, so that the blood will not return back again. I want the blood to go in one direction, like this. This door is called tricuspid valve. From the name, tri. So it's three openings. Okay? Now the blood is in the right ventricle. From the right ventricle, the blood will go to the lungs to become oxygenated. Here also, I have another valve, but it's like a half moon valve. The shape of the valve in real life even, it's like half moon. So it's called semi-lunar valve. Why I have a valve here also? Because when the blood will go in this tube, I want it to go to the lung. I don't want it to return to the right ventricle. Okay? Now the blood reached to the lungs. The blood is oxygenated. It will return back to the heart by this tube. This is called pulmonary vein. From the left atrium, the blood will go to the left ventricle. Again, it will pass by a door or a gate. It's called bicuspid valve. So it means it's only only two openings. This one is tri, three openings. Now the blood is in the left ventricle. From the left ventricle, it will be pumped to the whole body, oxygenated. Again, here also we have the same valve. It's called semi-lunar valve. The blood will go to the whole body by the main artery in your body. It's called aorta, the biggest artery in your body. This tube also, it has a name. It's called pulmonary artery. Again, let's recap again. So we agreed that the blood will be collected to go to the heart. The heart will take the blood to the lungs. Why we are taking the blood to the lungs? To make it oxygenated. And from the lungs cannot give it to your whole body. It's not the organ responsible to give it to the whole body. So it needs to return it back to the heart. And the heart will be the person to give to your whole body. How is this happening in details? Let's start. We have two main veins. Vein, it means it's blue. Okay? It's big veins. Superior vena cava, it will collect deoxygenated blood from upper body, superior vena cava, up. Inferior vena cava, this is the vein that will collect deoxygenated blood from the lower body. Low. Inferior, low. Now, these two veins will take the blood to the first room of the heart, which is called right atrium. From this room, the blood will go to the right ventricle, but it will pass through a gate. It's having 3 doors. That's why it's called tricuspid valve. It's a 3-gate. The blood will pass through this gate, it needs to close. So the blood will not return back again. So some people you can see in old age or even some young people, they have problem in this kind of valves. What happens? The blood will return back again. So it means the full amount of blood will not reach to the body. It's like 60% only of the blood reaching the body. That's why they are doing surgeries, because this door needs to close so that the full blood will go to your whole body. It's not that some blood will go to your whole body and then some others are going back. All the blood needs to reach. Okay? From the right ventricle, the blood will pass to the pulmonary artery, this tube, and it will reach the lungs. Now the blood is oxygenated. It will return back again, but it will return to the left side of the heart. So it will pass by the pulmonary vein. From the pulmonary vein, it will go to the left atrium. From the left atrium, the blood will pass to the bicuspid valve, a 2 doors gate. From this, it will go to the left ventricle, and from the left ventricle, it will go to the main artery of the body, which is called aorta. And then it will be pumped to the whole body. So here in aorta, we have 2 divisions. One tube will go to the upper body to give blood to the upper body. It's called ascending aorta. And another division that will give the blood to the lower body, it's called descending aorta. Now the blood reached to your whole body oxygenated. Okay? Remember in the beginning of the class we said that artery, it's red and it's carrying oxygenated blood, and vein, it's blue and it's carrying deoxygenated blood, right? We said this in the beginning of the class. But here you didn't see something. Here it's called pulmonary artery. So it was supposed to be red and it's supposed to be carrying oxygenated blood. But no, it was still carrying deoxygenated blood. The blood was before it reaches the lung to become oxygenated. Same thing for this pulmonary vein. It's vein, it's supposed to be blue and carrying deoxygenated blood. But no, it was carrying oxygenated blood. It was carrying the blood after it reached the lungs. So this is the only artery and vein different than your whole body. The pulmonary artery and pulmonary vein. It's artery. It was supposed to be red, but it was blue. Why? Because the blood didn't reach the lungs yet. Same thing for pulmonary vein. It's supposed to be blue, but it was not blue. It was carrying oxygenated blood. You got the point?
Yes, and in the picture, the 15 is the tricuspid.
The 15. It's the tricuspid. Yes.
Because we don't have here.
The division here is different. That's why. The drawing is different.
We have the key until number 14. We don't have the 15.
Yeah.
I guess the 15 is tricuspid.
Yes. If you put it like this, it will be the same. Yeah? So this is tricuspid, this is bicuspid. Okay? Is it difficult?
A bit.
Okay, I will ask you something. Which valve is between the right atrium and right ventricle?
Tricuspid.
Tricuspid.
Okay. Which valve is between the left ventricle and the aorta? Semi-lunar. Semi-lunar. We said that it's half moon. Instead of full moon, it's half moon. Semi-lunar. Lune in French, it means moon. So semi-lunar, it means half moon. Okay, you can write it. If it's not in the book, write it.
No, not it. Where it is?
Maybe it's in the next pages. Just write it. Okay? So before the pulmonary artery and before the aorta, we have semi-lunar valves, half moon shaped valves. So again, like we said, the heart has 4 chambers or 4 rooms. We have the upper 2, it's called atrium. The lower 2, ventricle. I have right side of the heart, left side of the heart. The right side of the heart, it's carrying deoxygenated blood. Blood that doesn't have oxygen. Because the 2 veins of the body, the 2 main veins, they collected all the deoxygenated blood from your body. So this side of the heart, it's still without oxygen. It still didn't go to the lungs. Okay? Then the lungs returned the oxygenated blood to the left side of the heart. So the left side of the heart, it has oxygen. Okay? That's why usually if anyone has problem in this valve in arteries or in any of the veins, this side, the surgery, they don't do it this much fast. They still wait to do the surgery. But this side, it's very risky. It's oxygenated blood. So if surgery is not done, there will be other problems because this is the blood going to the whole body. So sometimes that's why you will see people that have problems in this side of the heart, they have rapid heartbeat, more rapid. They have other symptoms like breathing difficulty. They cannot do this much of effort. Small effort, they are like, okay? So this side of the heart, it's much more dangerous because it's more filled with oxygen. This is the oxygenated side, okay? So again, if I ask you which artery is responsible to carry the blood from the right ventricle to the lungs, which artery is responsible to carry blood from the right ventricle to the lungs? This is the valve. Pulmonary artery. The tube itself, it's pulmonary artery. The valve is semilunar, okay? I just wrote it in the wrong way. Okay, which vein is responsible to carry blood from the lungs to the heart?
Pulmonary vein.
Pulmonary vein. Okay, what is the main artery of the body?
Main.
Main artery of the body.
Sorry.
Aorta, yes. side of the heart, it's carrying what? Blood that is deoxygenated. This side,
It's oxygen.
oxygenated. So here, like you can see, we have this part. This is called septum. It's like a membrane so that the two bloods will not be mixed. We will not mix the oxygenated blood with oxygenated. So this is the separation. Sometimes people, they have hole. So what will happen? Blood will be mixed. What they will do? Surgery. They will put mesh. They will put something so that the blood will not pass.
How will it come? Genetic.
Genetics. It can be, yes, genetics mainly. Okay? Any questions? Okay. So the side, this type of circulation that is happening, whatever is happening between heart and lungs, this part, okay? And when the lungs are returning the blood back to the heart, this part is called pulmonary circulation. So what is pulmonary circulation? It's the circulation that is happening between heart and lungs. When the heart is giving the lung the deoxygenated blood, the lung is making it oxygenated and the lungs is returning it back to the heart. This is called what? Pulmonary circulation. We have another circulation. This is something happening between the heart and the body. This is called systemic circulation. So till now we have two circulations happening. One is something happening between heart and lungs so that they can make the blood oxygenated and return it back to the heart. And I have another circulation happening between the heart and the body. It's called systemic circulation. Okay? System, yes.
Between heart and body.
Heart and the body. Yes, you will find this, it's written page 85, two closed systems here. Okay? Okay, so here in the right atrium, I have a point. This is where the electricity of the heart begins. So the pumping or the contraction of the heart begins from this point, and then it will go to the atrium, ventricle, arteries and veins. This point is called pacemaker, or the other name of it is SA node. What is a pacemaker or SA node? This is the point where the electricity of the heart begins. So usually if a person, you can see this, if a person has irregular heartbeats, sometimes fast, sometimes slow, it's not regular. Sometimes they have a type of contraction that they can see their heart pumping, they feel it. They do what? They do artificial pacemaker transplant. They will put something, this is what will regulate the heartbeats. This is the one, artificial pacemaker. Okay? So you'll find it written here, page 86. In the right atrium, we have a point, it's called SA node or pacemaker.
It's for when the beats are high.
Irregular. Not high, not always high, sometimes low. So when it's irregular like this, a person even will not know what medications to take. So if it's just high, people will take medication to make it lower. Normal, okay, logic. If a person has low heartbeat, they will take medication to make it higher. But if it's irregular, high, low, then you don't know what to take, okay? So this is the thing. Any questions for the circulation of the heart? If I ask you any question in this, you will know? See how many names?
No.
See the board?
Yeah.
Okay, what is the vein that is responsible to carry deoxygenated blood from the lower body?
The IVC.
Inferior.
Inferior vena cava, yes. Okay. Okay. What is the artery responsible to carry oxygenated blood to the upper body?
Upper body.
Pulmonary.
No,
Artery.
pulmonary is coming out.
Ascending aorta will carry oxygenated blood to upper body. Descending aorta will carry oxygenated blood lower body. Pulmonary vein,
Aorta.
it's not upper body. It's taking the blood from the lungs oxygenated to the left
heart.
side of the heart, which is left atrium. Okay? Okay, what is responsible to prevent mixing of the two bloods?
Septum.
Septum. What is the structure that regulates the heartbeats? Pacemaker or SA node. This is the regulation of the heartbeat. This is where the contraction or the electricity of the heart begins. Okay. What is the structure that helps maintain the blood flow in the heart only in one direction?
I cannot understand the question.
Valve.
What valves? It's general question. I'm not telling you which exact valve, but the valve, what is the main function of it? To maintain one direction flow. I want the blood to go like this, I don't want it to return back. I want the blood to go like this, I don't want it to return back. So the valve, general question. Valves are the structures that maintain the blood flow in one direction. Okay?
Okay.
What circulation is responsible to transport the blood from the heart to the lungs and back again? What circulation is responsible to transport the blood?
Pulmonary circulation.
Pulmonary. Transport blood from the heart and lungs and back again. So it's pulmonary circulation. What's the circulation that transports the blood from the heart to the rest of the body?
System.
Systemic circulation, yes. Okay, if you go down page 85, how does the heart look like? So for the heart, it's a red, hollow organ, and it's the size of the owner's fist. So if you close your thumb like this, you close, this is the size of your heart. Put your thumb and close. This is the size of your heart. So of course, as we know that the heart is on the left side. It's not on the left side, it's in the middle, but the bottom it's twisted to the left side. That's why you feel it's on the left side. That's why they tell you don't sleep on the left side, sleep right. Right? Because if you sleep left side, then you will press on your heart. But it's not like this.
And is it true or
No, not that much. No.
Hips.
Page 86, we have the layers of the heart. So the first layer, it's the endocardium. Endo, it means it's the most inner layer. The second layer, it's the myocardium. Myocardium, it's the heart muscle itself. And the last layer, it's the pericardium, like epidermis, Pericardium, it's the most outer layer, and this is what helps hold the heart in its place. So when you move, your heart will not move. It's stable, okay? So again, endocardium inner, myocardium second and middle and muscular layer, and the third is pericardium, it's the most outer layer, okay? If you go more down, you will find what is heart beat. What is heartbeat? Heartbeat is the pattern of muscular contraction of the heart. What does it mean? Heartbeat is when both atriums, they are contracting and the blood will go in the ventricles. And then the ventricles are contracting and the blood will go to the arteries, to the aorta and pulmonary artery. And then the heart relaxes. So contract, relax. This is called pattern of muscular contraction of the heart or heartbeat. What's happening in the heartbeat? Atrium contract, then the blood will go to ventricle. Ventricle contract, blood will go to arteries, and then the heart will relax. But for the heart, when it relaxes, it's not like the muscle. It's not completely relaxing like this. When the heart relaxes, it fills itself with blood. So it's taking blood. This is the relaxation of the heart. So for the contraction of the heart, put a line, it's called systole. And for the relaxation of the heart, it's called diastole. Yes. So put a line under what is heartbeat. It's the pattern of muscular contraction of the heart. Both atriums, they contract, they pour the blood into the ventricles. Then the ventricles contract, they pour the content into the arteries, and then the heart is at rest. And when the heart is at rest, it fills itself with blood. So the period of rest is diastole, period of contraction is systole. Okay? You'll go right side. What is a pulse? What's the difference between heartbeat, now what we said, contract, contract, pull, relax, and pulse? Pulse is the heart rate. What is heart rate? How you check for heart rate?
How
Yes.
many beats in a minute?
Exactly. How many times this contraction that we said is happening in a minute? Okay? This is a pulse or a heart rate. So put a line under. Pulse is the number of times the heart beats in 1 minute. How many times the contraction is happening in 1 minute? This is called heartbeat. This is called in 1 minute heart rate. Okay? If you go more down, you'll find, is the heart rate always the same? Of course no. Heart rate can change. According to what? It can change in unhealthy people and even it can change in a healthy person. Same when you exercise. Of course your heart rate increases.
Emotion.
Exactly, your emotions. If you are sick, also the heart rate increases. If in age difference, so in babies, the heart rate is faster. When you start growing, the heart rate starts reducing. Okay? What else? Some disease. Like what? If a person has fever, the heart rate is faster. If a person has bleeding, when you are bleeding, hemorrhage, the heart is trying to compensate the blood loss. So it's starting to beat more, to give more blood. Okay? What other things reduce the heart rate? Jaundice. You know what's jaundice? When the skin starts to turn yellow, the eyes are yellow. You know, a person is vomiting a lot, the bile is very high in the body. This is jaundice. So a person with jaundice, the heart rate is slow. Yes. What else? Pressure on the brain. If a person has any pressure on the brain, maybe more water, they have tumor in the brain, something like this, also this will reduce the heart rate. Okay? So again, as we said, the heart rate can change in a healthy person or in an unhealthy person. Sometimes when you are healthy, you are exercising, the heart rate will increase. When you are excited, you have too much emotions, heart rate increases. What else? As we said, age. The age difference in babies or infants, the heart rate is faster. In adults, it's much more slower. Okay? And the size of the heart. Also, the size of the heart is one of the things that affects the heart rate. So when the size of the heart is smaller, the heart rate is faster. Okay? So for example, for the size of the heart, you can see this in athletes. athletes that do heavy weight training, they carry too much weight to do these bodybuilding things. What happens? The ventricles, they start to become thicker. The muscular layer in the ventricles will become thicker. So instead of you have all this space for the blood, the ventricle is thicker, so they have this much space only for the blood. Only this space.
The heart size can be changed in the life.
Yes. Smoking, nicotine, alcohol consumption, too much heavyweight training, okay? Breathing difficulties. It starts to change the heart size. That's why also when a person is obese, they have too much fat. There is too much fat layer on the heart. Instead of only being thin layer, no, the heart is having more fat. So it's not good for the heart health, okay? So for heavyweight training athletes, the ventricle, when it starts to get small like this, less space for the blood, the heart rate is increasing. That's why we hear a lot that athletes are dying, right? From heavyweight training, okay? Any questions for this part? Heartbeat and heart rate? Okay. Next page, page 87, this is what we said in detail for the pulmonary circulation, superior vena cava, inferior vena cava, and all these things. But I think this way it's much more easier to remember, okay? Here on the right side, page 87, we have a third type of circulation happening. Remember we said pulmonary circulation and we said systemic circulation, right? We have a third type of circulation. Remember when we spoke about the layers of the heart? We said that the second layer of the heart is muscle, right? The middle layer, it's muscle. So it means that the heart is not only there to pump blood, it needs also its own nutrition and food. It needs to have its own circulation. So this is the third circulation that we have. It's called coronary circulation. This is for the heart muscle or heart tissue itself. As we agreed, the heart is a muscle. It needs its own food. It's not only there to pump blood, but doesn't eat. It needs its own food. So we have coronary circulation. This is for the heart muscle itself. You don't need to know the details. It's not important. Just here you have a coronary vein. It will join with the superior and inferior vena cava. And then you will have from here coronary artery separate to go to the heart and give nutrition to the heart. Okay, not important. Next, page 88, you have the last type of circulation. You have the circulation down. It's written in a small table in a box down. It's called portal circulation. What is portal circulation? Portal circulation is a circulation between your abdominal organs. So you have veins from the stomach, spleen, pancreas, and intestine. These four organs, the veins, they join to pour all the blood into the liver. This is called hepatic portal circulation, the fourth circulation. Okay? So again, it's something between the abdominal organs. Like we said, four organs, the veins of these four organs join together to put all the blood into the liver. Okay? Any questions? Any questions so far for the first part of the class?
No.
We have second part of the class, so check if you have any questions.